All right, let's talk about something fascinating. The human heart. It has this incredible language, right? A whole symphony of beats and rhythms. And today, we're going to learn how to crack that code.
I mean, just think about it for a second. What if your heart could actually talk to you? Well, it kind of does. Every single beat, every little whoosh, every click, that's all information. It's telling a story about what's going on in there. And doctors have a name for this, for listening to that story. It's called cardiac auscultation. And let me tell you, it's a super powerful tool for diagnosis. So yeah, let's dive in.
So, at its most basic level, auscultation is just listening. But for doctors, it's way more than that. It's the key to spotting everything, from a totally harmless little heart murmur all the way to a really serious valve issue. And if you want to master this, you've got to know the rules, the right spots to listen, and the exact order to do it in.
Okay, so before we even start our journey, we've got to get prepared. I mean, you can't interpret these sounds if you can't even hear them clearly, right? It's like setting up your base camp before you start a big climb. You have to get the basics right.
All right, so there are 4 big rules for getting a clear listen. First up, you need a quiet room. Seriously, you're listening for super subtle sounds, and any background noise can just wash them out. Second, you've got to press that stethoscope firmly against bare skin. You need a good seal so you don't miss anything. Third, think of the stethoscope as your focus tool. It helps you zero in on exactly what you need to hear. And finally, number 4, you have to listen while the patient breathes in, breathes out, and even holds their breath. Why? Well, it helps you separate the heart sounds from all the noise the lungs are making. It's all about setting the stage perfectly. Okay, we've got the rules down. Now for the fun part. It's time to pull out the treasure map of the human chest. See, the chest isn't just a random area. There are 5 very specific spots, these key landmarks, where you can hear the heart's valves the clearest. Let's call them our listening posts.
So here they are, our 5 key spots. We're going to listen to the mitral valve, the aortic valve, the pulmonary artery valve, and the tricuspid valve. And then we're going to finish up at this really interesting place called Botkin's Point.
First stop, the mitral valve. This one's right over the apex of the heart, you know, the pointy part at the bottom. To find it, feel for the space between your 5th and 6th ribs on your left side. It's about 1 centimeter inside the line that runs down from the middle of your collarbone. That's your spot.
Okay, from there, we're moving up. Landmark number 2 is the aortic valve. For this, you'll go to the space between your 2nd and 3rd ribs, right up against the edge of your sternum. That's your breastbone, but on the right side this time. That's the sweet spot to hear that powerful aortic valve.
All right, number 3 is super easy. From where we just were, you literally just slide the stethoscope across the sternum to the exact same spot on the left side. You're still in that 2nd intercostal space. And this is the best place to listen to the pulmonary artery valve. Landmark number 4 takes us down to the bottom of the breastbone. You know that little bony tip at the very end? That's called the xiphoid process. We're going to listen right there, just to the right of it. This is where you get the best sound from the tricuspid valve.
And that brings us to our final landmark, number 5, Botkin's Point. You'll find this one in the 3rd intercostal space on the left side, so just a little bit below where we were listening for the pulmonary artery. Now this spot is special, and we'll get into why in just a minute. Okay, so we've got our map. We know the 5 landmarks, but just knowing where they are isn't enough. A map doesn't do you any good if you don't know which route to take, right? And when it comes to listening to the heart, the sequence, the path you follow is absolutely critical. You can't just jump around randomly. And here is that exact path. You start down at the bottom with the mitral valve, then you go up to the aortic valve. From there, you swing across to the pulmonary artery, then head back down to the tricuspid valve, and you finish the whole circuit at Botkin's Point. Following this exact order is so important because it lets you compare the sounds methodically, making sure you don't miss a single thing.
Okay, so remember I said Botkin's Point was special? Here's why. It's not actually for a different valve. It's a 2nd listening post for the aortic valve. So why listen there? Well, it turns out this spot is fantastic for picking up something called aortic insufficiency, basically a leaky aortic valve. Think of it like getting a second opinion, but from a slightly different angle. It can help you catch problems you might otherwise miss. So you've done everything right. You followed the rules, you hit all 5 points in the right order. Now what? What are you actually listening for? Well, you're hoping to hear that classic, clean, lub-dub sound. But you're also on the lookout for anything that sounds off. Things like clicks or gallops, or the most common one, murmurs. A murmur can sound kind of like a whooshing or swishing noise happening between the main beats. And this is super important. If you hear a murmur or any weird sound at one of those 5 main points, that's your cue. It's the signal to broaden your search. The clinician will then start listening all over the entire chest, trying to pinpoint exactly where that sound is coming from. So you see, these 5 points aren't the whole story. They're just the starting point.
So, yeah, every single heartbeat really does tell a story. This whole process, it's about learning how to listen to that story, how to decode it. The only question is,